In two sentences, what was your idea and how does it change the world?
I love that. Cindy, go ahead.
All
Take it away.
right. So, our idea, both Lisa and I, had this idea of really becoming the first two women to have a platform for women who work in our industry in the US in medical device. And what we really want to do is help other women thrive in a male dominated industry. And we've kind of coined the term CEO of your own career path. And we spend episodes talking about ways to empower these women to become whatever they want to do. Get promoted, get into medical device industry. Lisa and I together combined have about 40 years experience. So it's our shortcut to help anybody into this so they don't have to reinvent the wheel.
Yeah, and I'll add to that. So Cindy didn't say this, but the idea came actually because 4 or 5 years ago, she and I would call each other on the phone when we were driving, and she'd send me a podcast and she'd say, well, you need to listen to this podcast. And it could be on real estate, but one little value bomb that was dropped during the podcast, she wanted me to hear. And so we started realizing that over the course of like a couple of years, we were sending each other these podcasts that had nothing to do with medical devices, but the advice was pretty good. Right. But it was like here and there, and we were pulling. And one day Cindy and I were talking, and she's like, why don't we just do this ourselves? And this time we make it for what we want to hear the entire time. We want it to fully concentrate on medical devices and fully concentrate on women and the issues that we seem to face in a male dominated industry that men may or may not even recognize happens. And, some of these subjects are pretty touchy. But we want to really bring them out, bring them to light, and talk about them because we've been through them. I mean, we talk about everything from personal struggles to struggles that we've seen or that we know people have been through. And we talk about them, and we talk about how to survive them, how to be successful with them, how to jump those hurdles, how to get those promotions. And like Cindy said, thrive in the medical device arena that is a male dominated arena.
And Lisa and I together have very different backgrounds. And I think one of the things that really pulls us together is the fact that we have two completely separate pathways. And we met almost 6 years ago when we joined the same medical device company. And there were very few women. We could count on less than one hand. So it was probably 6% women in the entire field. And so, it was very interesting how we found ourselves, just like she said, leaning on each other. And so to let you know a little bit of what I mean about the difference, I'll start with, my background is that I graduated from college and was a nurse. From there, I went on and got my master's degree and worked as a nurse practitioner. So I spent the beginning of my career working with all women. I was in an industry where you clock in and you clock out and you see patients. And one day when my husband switched careers from corporate America, became a firefighter, I had this awesome opportunity where somebody came up to me and was like, I want you to meet my boss. I always thought you'd be good at sales. I want you to go talk to him. And one thing led to another, and that started my career path into medical device, which essentially was an entire education of science and clinical education and nothing in business. Total opposite for Lisa.
Yes. Yeah. I started really early on. My father was an orthopedic surgeon, now retired. And so I spent my entire childhood and growing up in the hospitals with my dad, doing rounds, being around patients, loving the nurses, loving the doctors, watching him work with his sales reps. And I really loved that whole thought process and aspect of being able to be in surgery and helping the physicians, but not actually needing that medical device medical license in order to help them practice medicine, if you will. And so after I graduated college, I was in public relations for a little while, and I realized that was not really my calling. And so I early on jumped into the medical device industry after 2 years of trying to break in. So it took me a little while, even with my father, who's an orthopedic surgeon, and I had a lot of connections, it still took a while because the medical device industry that we talk about in our podcast, it's a very small, very unique industry. And well, it's growing now, but it's very hard to break into. Once you get in, it's better, and you're able to move around a little bit, and people know each other, But for the most part, it's really tough to break in, and it's really tough to break in as a female. And I was 22 years old trying to break into this very male dominant. I mean, we're talking 23 years ago, 24 years ago. I think I was like one of two female in a massive major medical device company that had over 150 sales reps. And it was like me and one other lady, and I'm brand new, and she'd been there for 10 years. So it was definitely intimidating, scary. But I learned a lot. And through the course of my entire career of working with a couple different medical device companies, those larger Fortune 500 companies to some really small startup companies, I can tell you it's an amazing place to be. It is so gratifying. It gives back in so many ways, and not just financially. It is a fantastic place if you are a people person, you're a go-getter, you want to work hard, you want to play hard. Yes, you want to have financial success, but you also want to dream big and receive big. I mean, it is a really cool place to be.
So, how long do you have this podcast already?
So we started our podcast just about a year ago in July. So we were very excited as we're coming on to our 1-year anniversary. And in that time, it's been very humbling. And the impact that we've had on women who have reached out to us, who have asked us, how did you get into medical device? Will you look at my resume? Do you have any networking opportunities? It's when Lisa and I would drive in the car and talk to each other, she brought up something a few minutes ago about how challenging it can be and how hard this job is. Then you tack on that you're a woman and everything is 10 times harder. And there are many men out there who are wonderful, many doctors who are wonderful. And just where we live in the US, it's just harder for women. And so, like Lisa said, she started young. I started, almost 20 years ago, but with a different entry into it. And we just see these women who have struggled or who want to be here. And we want more women with us. So the idea of doing this podcast a year ago was really to give back. And the crazy thing is how much Lisa and I have gotten out of this. And it's been so warm. And just to be able to help these women, and it's exciting and just growing, and it's just more and more people reaching out and asking us to do more has been phenomenal.
That's a great point, Cindy. We have really learned a lot over this past year, just about ourselves, about the business, about struggles. But I think the culmination is we've learned that we're not alone out there. And I think that's really why one of the reasons why Cindy and I wanted to do this is we not only want to give back, but we want women to feel like they've got a support system. They've got an older sister, or a mom, or whatever, a confidant, a mentor, which is, we talked a lot about mentorship on our podcast. We want them to know that not only are they not alone, but we've probably heard, faced, been challenged with everything that they hit along the way. And if we haven't come across it, we probably came across something very similar to it. So we just want them to know and hear our own stories, what we've learned from our stories, what they can learn, so that they don't have to reinvent the wheel. They basically can say, oh, here's this episode on this. If I did XYZ, I don't have to deal with ABC. I'm just going to go straight to the end and cha-ching, ring the bell. And I think that's something that Cindy and I felt like we were missing in our lives with regards to calling each other all the time. And, we were pulling from here and there and everywhere, but man, it's been really awesome to have a support system and a platform where we can just talk about things. And sometimes we're talking about like current events, things that happened just recently in our past. I mean, we are both still very heavily involved in the medical device arena. I'm a sales rep, and Cindy just recently took on a leadership position as a director. And we are still in the trenches every day. We are hearing it, feeling it, seeing it. We're losing and we're winning. And we know everything about this industry, and all we want to do is help women know that they're not alone.
And Lisa talked about how women can feel alone. So I just want to paint a little picture for those that don't really understand what we mean about medical device industry. So this is kind of how it looks for us in a day. Every day can be different. But for instance, we might have our computers out of our home, and all of the places that we go are usually hospitals. They may be doctors' offices, but there's different stages of medical device, and one is in the operating room. So we get in our cars, and sometimes we drive 2 and 3 hours to get to a hospital for a scheduled surgery. Sometimes we're spending the night in a hotel. So I don't go into an office every day. I don't have a cubicle. I don't have somebody next to me. All I have is my phone in the car. And it's amazing how you can be in the car, and if you find somebody who inspires you, who lifts you up, who encourages you before you go into that surgery, how amazing your day can be and what support you can provide for that physician. Because essentially our roles as medical device reps, we use that position where we go in and support the doctors in the surgery, and we have a device that they are using on a patient. Should they have questions about how it's deployed, should something go wrong, we are an extension of their team, and we get to partner with them. And it is a very exciting and rewarding place to be. And yes, once you get in the hospital, you then have another team. But again, you stand alone in representing your company when you're in there. But how great is it now that we have opened this platform for women who now have somebody to reach out to, who can drive in the car thinking about, I have this challenge today, look through our episodes and find the topic and listen to it and come out inspired, as we had a reader tell us once. So, as we had a listener tell us once. So it can be very good giving back to these women.
Yeah. And you're right. Sometimes it feels really lonely because you're out here, you're manning the entire business yourself. You're running it. You're in control of it. Doctors are calling you saying, hey, I need you here for this case. And oh, by the way, you're still running a household. For most of us women, we still are running a household as well. We've got husbands, we've got partners, we've got kids. The mom guilt kicks in every single day for me. And it's hard. And you can't really go to your customers and say, oh, well, my poor baby, I'm leaving my baby today. It's one thing if the child is sick, but it's another if it's just you're feeling guilty about leaving the child at home, or your son has a basketball game. And it's like, hey, they understand, but at this point, they just need to get their business done. They need you there to support the case. They're not there to listen to you moan and groan about, home issues. So it's really nice when Cindy and I can get together and talk about just being a woman and being a mom and being a wife or a partner, and talk about all the struggles that we go through that men honestly don't face as much as we do. So,
exactly.
It's really a place that, like I said, a platform for us to support women.
And as both of us working full time on our jobs, we happen to be the breadwinners in our family, and that's important. So your job is important. And so, Robert, I have a question for you, actually, since we are in another country. Can you tell us what it's like for women working in Slovenia? Do they face the same challenges Lisa and I are talking about today?
Well, so far, I only have one person from Slovenia who said that his only workers are men, and he's producing machines for de-alcoholizing wine.
Oh, wow.
Yeah, and he said that he had some women working for him, but the parts are too heavy for them, so he's having only men. But otherwise, I think that there's no really man occupied industry here. Perhaps steel industry, I don't know, because it's also hard work and things like that. But where you have the expertise, like in your case, I don't think so. I think that I know a lot of CEOs of successful companies, big companies, small companies, successful women. They I think they congregate very much here in Slovenia, and they have a strong movement and support. So I think, or perhaps it's just my view that there is they are in better position here in Slovenia than in US.
That's refreshing to hear. I mean, that's shocking, actually. As a U.S. woman, I don't know. I'm gonna just admit it. I'm not like super super smart when it comes to other countries and definitely Slovenia. But that's very inspiring to hear that because we here in the US really do believe that we all have this equal opportunity and that everybody is able to achieve whatever they want to achieve. But the reality is there's still many male dominated industries. And I'm not saying that's a bad thing. I'm just saying that we still haven't reached that pinnacle where it's an open forum, where both are accepted and are able to just go for the same position. It still is relatively harder for women to break into this industry than men. And we've seen some very successful women in this industry. I mean, I know 2 or 3 women CEOs of companies, major medical device companies, and they're phenomenal. But it still is a struggle. It's still hard for them. And maybe it is in Slovenia as well. But it's very refreshing to hear that they are there and they're leading companies.
Well, I think that this women movement in Slovenia is kind of successful, and there are a lot of positions. Okay, we have a women president right now.
Oh, wow.
That's amazing.
That's awesome. I didn't even know that.
Yeah,
Me either. Excuse
but
me for my
yeah, no problem.
ignorance.
I know.
So yes, I think that women here are aware of their worth, and and also men. I think I really like working with women. It's different energy, and I think men are more arrogant, more I don't know. We take things for granted, and women are more, I don't know, passionate and into things. So I really like working with women, and yes, but I think perhaps I have the feeling that there's not that hard to get to the good position in Slovenia for a woman.
Well, I think that's phenomenal. And it's so, like Lisa said, it's just refreshing. It's encouraging. So was there any type of turn of events or anything in the history that changed where women were, suddenly recognized? Or I am, again, ignorant in thinking that men started working and women came along later. And I'm just curious, in Slovenia, was there any event or any time period where it changed?
Well, I don't know for before, because, but I think from the Second World War, a lot of women were in partisans who fight against Germans, and were high in the Communist Party in hierarchy. And I think that helps. That's one of the things that there were always women in the highest position in the country. Perhaps not that much as today, but yes, there always were. And I think that's one of the things that could be one of the reasons. And the other one is, I think that Slovenia was always somehow progressive countries. We saw that we are open-minded, and perhaps that's why women were not just in the kitchen and taking care of the children. They are perhaps in the country, but we have a pretty strong working class, and developers and engineers, and a lot of there. We have the engineer of the year, and it's a woman.
Oh,
That's
awesome.
wonderful.
That's great.
It's very interesting what you were talking about the end of the World War II, where you or what you said this whichever war you said that the women were, high ranking in the Communist Party. I actually recently read a book that's titled The Women. It was written by Kristen Hanna, and it talked about women in the Vietnam War. So in the U.S., women were not recognized in the Vietnam War. When they would come back from the war and they would recognize the heroes, they're like, there were no women in the war. Well, there were in the late 1960s. They sent nurses there, but it wasn't spoken about. And I'd love to hear that your country would have them high ranking in the Communist Party. And I think that's actually pretty great. And, I think that our podcast here in the US is looking at helping our women, or maybe if they're in a different country, and just really the little things that we can do to better ourselves. Sometimes, Lisa said, we talk about hard topics, but, even just going back to the simple things of day-to-day activity. I kind of painted a little bit of picture about how we ride in a car and we go somewhere. Well, that type of job takes organization. That type of job takes targeting, strategy, prioritizing. And I told you how I first started out as a clinician, and I would go to work and they would tell me what I needed to do, who I needed to see during that time. When you work in medical device, you have the freedom to do your job. So one of the things that Lisa and I do on our podcast is really try to help women get organized so they can prioritize, strategize, do their job, and then go home and be moms. And if they're going to cook in the kitchen or not, my husband, thank God he cooks, because he does most of the cooking, thankfully.
Great. I like cooking too.
Do you?
Yeah, I enjoy it very much.
But, you bring up a good point, Cindy. This is something actually that was recently told to me by one of the reps in the orthopedic world, is they're looking to hire more women now because women are more organized. We do know how to prioritize. I mean, let's face it. If you've got multiple kids running around and you've got activities and you've got family functions and you've got birthdays and holidays, you have to be organized. Otherwise, there's no way you're going to be able to get everything done in one day, right? So women, I think by nature, are very organizational, prioritizing individuals. And it's very important in our industry to be able to do that and kind of set up a time block for yourself, because you can easily waste away a day. I mean, anybody can waste away a day. And in medical devices, you're on your own. You set your own schedule for the most part. Other than being called in for certain cases, you sometimes have days where you could do nothing, right? But if you want to forge your career and you want to get more sales and you want to call in more customers, well, then you need to prioritize. You need to figure out where you're going that day, who you're going to call on, how you're going to call on them, what's important to them, and then the rest of the day, what does that look like? And oh, by the way, you're probably going to sneak in a run to the grocery store, maybe pick up a kid from gymnastics and, swing by and grab something from the dry cleaners before you're heading home. And that again takes prioritization and organization, and women are phenomenal at that. And I think sometimes we forget our value.
That is very well said.
I heard a joke the other day, and I don't think even that's a joke, that the women know the everything about their children, from the size of their shoes and clothes, and what subjects are on their schedule today, and everything. The man, no, there are some small people around the house, but that's not that far from the truth.
Right. Women have such an attention to detail. And, in men's credit, I will say that women may focus too much on the detail, where the men can step back and really just take charge of what needs to take charge. I think men and women working together is truly the best combination. And so one of our purpose is to really help women be their best so they can work alongside men. And we want women to know that, hey, if you want to go be, maybe leadership in a company, director, CEO, shoot, in your country, if you want to go be a women president, it's there. And, one of the things that along the way women need, it's just a female trait, is women need women. And if there's somebody there to cheer them on and bring out their strengths, remind them of their strengths, and help them feel that they have the knowledge, and then they get the confidence to go out there and seek what they want to seek. And we truly believe these women, when we say CEO of their own career path, you have the world at your fingertips, and you can be the CEO of your life, of the way you want to run your business. And whether you want to stay in medical, say you get in medical device and you want to stay a rep for your entire life, we want you to be the best. We want you to be the CEO of rep world in your world and get the most out of it. If you are a rep and you want to move on, one of the things we also do with our podcast is really help women say, okay, now I'm kind of plateauing. I'm in my career where I've done well. Is there more? Do I want to do more? And Lisa and I work on different ways and talk about, the encouragement that you need and empowering them, take that risk, go where the door opens, step into the next level. And now there's more challenges. And like Lisa said at the very beginning, she and I have been doing this a very long time in 2 different avenues. So 40 years combined, there's pretty much, we've seen it all to an extent. Never say never. I'm sure there's some crazy secret, but we have enough tools in our armory to help somebody problem solve through whatever challenge they're facing in medical device.
We really do. You're right, Cindy. And in different levels of our lives, right? Because I started at 20 something years old. Well, that's graduating out of college, basically. You had your nursing and clinical background. So that's, again, the same different position, but the same kind of starting out point. And then we've literally gone through our 30s and 40s and now into our 50s of being in these different medical device companies, positions within the companies. And we've won tons of prestigious awards, President's Clubs, Rookie of the Year, Founders Awards. We've been able to be very successful throughout our entire careers. And like Cindy said, we just want to help women understand that not only can they do it, they can achieve it, and they can do it however they want.
Absolutely. You got to believe you can do it first. And I know that sounds so cliche. You hear people say that. But one of the things when I look back in my entire career, which was 10 years in nursing, so I was in my early to mid 30s before I really got into medical device sales, whether I was working in a female industry or I was working in a male dominated industry, I think no matter where you work, no matter who you're around, you will face people who have a negative view of things and you face people who have a positive. If you can find a way to go to those people who lift you up and bring you up and more positive and learn how to tune out the noise, I'm telling you, it is an unbelievable sky is the limit opportunity for you.
100%.
Yes, I think Henry Ford says, if you believe you can, or if you believe you can't, you are right. And that's 100% correct. It's up to you, and people are, I think they don't really, most of people resonate with this, but don't really comprehend how powerful this is. Because if I say, okay, I want to run a marathon, I can. I just have to decide.
That's a great analogy.
Yeah. For instance, I ran 10 kilometers every week. And it's so simple. If I would say, okay, I want to run, I like this distance, 10 kilometers, and I often run even more. But if I would say, okay, I'll run, I don't know, 2 kilometers per day, it would be awful because I know I wouldn't be able to go every day. But if I say this is per week, that's no brainer. I go to the workout 3 times a week, and I can do it easily.
Well, and what you're talking about is a plan, right? You followed a plan. You have a goal, which is to run the marathon, and you didn't just willy-nilly it. You didn't just walk out there one day and run the marathon. You trained. You followed a plan. You followed a program. You did the right nutrition. You learned from people and they told you if you run at this and you do this 5 times a week, then you're going to progressively get better and train. And then finally, when you ran the marathon, you did well at it, right? We provide the same thing. When you have a goal ahead of you, whatever that goal is, let's just say to break into the industry, we will get you from A to Z during the course of that entire path to get you to that final goal of getting into the medical device industry. Or if you want to move up and become a regional director, We will get you there by steps with a program and a plan because we've done it. We already know how to do this. It's very simple for us to help others. And so I love that analogy. I mean, Cindy's a triathlete actually, or an Ironman triathlete. And so she understands very well on how to follow a plan.
And Lisa has also completed a half Ironman. So you have two triathletes that we get it. It's a training plan. Lisa said it right. You break it down, and we have the analogy of you don't think about an Ironman as being 140.6 miles. You take it one stroke at a time, one pedal at a time, and one step at a time. These are the things that Lisa and I put together in our podcast, and now working with consulting and coaching to break it down for people to make it that simple and have them achieve any goal, whether it's running an Ironman or getting to President's Club. That's what we're here for.
So if I want to be a president of United States, because you already have a Slovenian first lady, but if I wanted to be president of the United States, I came to you, right?
Well,
sure. Well, yes and no. we can begin the process.
We can help you with the mindset to get you there.
Yeah. We'll get you with the mindset, and then we're going to connect you with people in politics.
We'll give you a politician. Thank you, Robert.
I have a special guest for the end of this session.
Oh,
okay.
Yeah. But you can have some final thoughts if you have. I think we are at the end.
Just to thank you for your time. And I think Lisa and I have said already that we're just really here to support women. We love giving back to women, and we have truly appreciated the time you've spent listening to us. And I love the insight of learning more about Slovenia versus the US, so I can learn to, be thankful for what I have and where I am. And it's very interesting just to see how big the world really is.
Yeah. And small.
Agreed. And small.
And small.
Right. Yeah, this was fantastic. We really enjoyed ourselves. We love sharing what we do because we have a passion for it, and we want everyone to know that we're here to support them, however that looks. But at the very minimum, to tune into the podcast, get some good advice, maybe a couple laughs. We constantly are telling personal stories, so they're always really funny.
Right. You can find us on Spotify, on Apple Podcasts. It's called Secrets in Medical Device Sales, and we are the Girls of Grit. That is the name that we have given ourselves, since there's two of us and not just one. And we'd love to have you tune in and listen.
Yep. And our website is thegirlsofgrit.com. We are also located on Instagram as well as LinkedIn, Pinterest, and TikTok.
Okay. And now we welcome the third lady just to say hi.
Oh, hello. Hi.
Hello.
It's so good to see you, Tiffany.
Hi, Tiff.
Back, Robert. It was my friends here.
Yeah. I just wanted to say hi and thank you for introducing us, because we have a great talk today and I really enjoyed that. And I'm thinking of running for president. You heard. So
Thank you. It's the power of women. It's so good to see you.
Yes, power of women. Just for all of you out there, Tiffany is one of my closest, bestest friends ever. She's fantastic in business. She's writing a book on business secrets, and she's given us, Cindy and I both, a lot of great business advice. And this is women helping women. This is what we're all about. We are here to empower women to be their best selves in any way, shape, or form, whatever that looks like, whether you want to get into the medical device arena or you want to go into business and you want to become an entrepreneur. Tiffany can help you with that, and we can help you with the medical device industry. But this is women supporting women bringing each other up.
And thank you, Tiffany, and happy birthday.
Oh, thank you.
oh, happy birthday! I didn't know.
Thank you. I was watching the whole interview. It was wonderful.
Oh, thank you.
Thank you, honey.
I was
Thank
right
you.
here the whole time. So we're grateful that you're all on here. And thank you, Robert, for having all of us.
Thank you, Robert.
The pleasure was mine.
This was awesome.
Keep up
And
all
we
your
love
great
Slovenia.
ideas.
We love
I know.
Slovenia.
I want to go.
I know you
visit.
love it even better when you'll come here.
I think we
love
need a
to
business
visit.
trip. We need a business trip,
Absolutely,
ladies.
absolutely.
Ladies, we need a
Start at the
business trip.
beach. I like it.
Go to the mountains.
I love it. Thank you, Robert.
Thank you
Thank
so
you.
Appreciate all
much.
of your time. Thank
Okay,
you.
bye.